talk about Hordeolum, which is a sty, right? Chalazion, Blepharitis, and Conjunctivitis, which is the pink eye. So I know that we all may have experienced some of these, especially sty and a pink eye. But let's actually get into the pathophysiology of actually what is happening. All right, so the first one we're going to talk about is blepharitis. So, what is that? Basically, it's just the inflammation of your eyelids. So, what caused that? Not keeping your eyelids clean from bacteria. So, ladies, let's think of a common thing that we do that can put us at risk for blepharitis. Lashes, right? Have y'all ever seen those TikToks where they let the lashes stay on too long, and now they have all kind of build up crust and just infection in every way. So definitely keep that in mind. So symptoms, what is this going to look like? They're going to have stinging or burning in their eyes, a crusty buildup, debris in the eyelashes. So remember, this one is focused on the eyelash. They're going to have watery eyes, irritation. They can have dry eyes, itchy eyelids, and redness. All right, so how could this be treated? It could be treated with a warm compress, eye drops, cleaning their eyelids, and those two medications right there. Another remedy that we see done is actually putting a few drops of baby shampoo in a cup of water and putting a cotton ball in it or a washcloth in there and just gently cleaning the eyelids with that. Or some people even let the warm water run over their eyes. But we know if you catch it early on, then we could probably do just cleaning the eyelids. But if you catch it later on while it's now advanced, you may need to go to the doctor and get some type of medicines, like those medicines that are listed on the screen. So definitely remember blepharitis. That is an eyelash problem, an infection or inflammation within the eyelids. Okay. All right, so the pink eye, right, which is conjunctivitis, right? So anybody had the pink eye? I don't think I ever had the pink eye, but I know a lot of people who have the pink eye, who had the pink eye, and who seem to get them all the time. But there are three types of conjunctivitis. We got viral, we got allergic conjunctivitis, and you have bacterial. So in viral conjunctivitis, what is it caused by? It is caused by a virus. So sometimes the common cold, after when people are sick, they'll get a pink eye. What else? It's very contagious, but usually will clear up on its own or 7 days without medical treatment, within 7 days without treatment. So normally if a person has viral conjunctivitis, they won't go to the doctor for it, right? Viruses, so remember viruses, when we have viruses we do not take antibiotics, right? So this one will clear up on its own. Now remember, this patient is very contagious. Okay, so allergic conjunctivitis, allergies, right? So this is when you start to get redness in the eyes and stuff like that after the allergy season, right? So that's one of the things you just want to keep in mind, right? Pollen, if you're allergic to dander, dust, any kind of stuff like that, anything that can just get your allergic responses to start responding. So your bacterial conjunctivitis, this is caused by bacteria, right? So if it's caused by a bacteria can be treated with antibiotics. So we definitely want to tell this patient to go to the doctor. But the thing about it is, when we're talking about the different types of pink eyes, you're not going to know which one you have, unless it's the allergic conjunctivitis, and that you were introduced to something you was allergic to, and now you have this one. But now you have these signs and symptoms. But if you have viral or bacteria, you're not going to know. So you need to go to the doctor to figure out which one that you have. All right, so what signs and symptoms will a patient have if they have conjunctivitis? So if they have the allergy one, there is itching and redness of the eye, swelling of the conjunctiva and the eyelid. If they have viral, you'll see redness of the eyes and some itching and increased tears. If you have bacterial conjunctivitis, you're going to see redness, dryness of the eyes and the skin around it, and you're going to see a purulent drainage, okay? So you see that yellow drainage, that already lets you know that this is an infection. So what are you going to do about this one? So like we said, viral, that one normally resolves on its own, right? Bacterial, you need to get antibiotics, right? And your allergic conjunctivitis, you're going to manage that by avoiding the allergen. So if you know that you are allergic to dogs, then don't go around dogs. But you can also take your antihistamine eye drops, right? So those are the drops that you can find at CVS or something like that. So the biggest thing is you want to make sure that you teach your patient to go to the doctor to figure out what type of pink eye that they actually have. Because if your patient has bacterial conjunctivitis and that bacteria goes untreated, that patient can suffer some severe consequences from not getting that bacteria treated in their eyes. So you want to make sure to tell them consult their doctor. All right, so now we're going to talk about Chalazion and your Hordeolum. So I'm gonna call Hordeolum sty, okay? So with your Chalazion, that is caused by a blocked oil gland in the eyelid, and your patient is gonna have what characteristics are gonna be painless, but it's gonna be swelling and it's gonna be firmer than a sty. Now with your sty, you're gonna see a painful red lump on the eyelid, and it's gonna be full with pus. And the cause of that is going to be a bacterial infection of the eyelid. So remember, one is just blocked oil gland, that is just blocked, and then you have your sty, which is an actual bacterial infection. So we know that with your sty, we're going to have to get that treated with what? Antibiotics, right? But your Chalazion, we can treat that with a warm compress, steroid shots, and if it's really bad, then you can have surgery. But I've never seen anybody have surgery on that. But definitely know the difference between the two. All right, so 6 ways to treat a sty, because you will run into patients who have one, and definitely your family members, and you already in nursing school. You already made it to med surg, so they think you a nurse already, which you are. But they're gonna have questions about this. So you want to tell them, how do you treat a sty? You want to wear your glasses, no contacts, right? Stop wearing eye makeup. You want to wash your hands before and after touching the sty. You think that this is something fundamentals, but people really don't wash their hands. So you want to make sure that you're educating your patients to wash their hand and not touch their eye. But sometimes it's just a habit that you just go for your eye. You want to teach them to clean their eyelids. They can apply a warm compress and to massage the area. So what is a warm compress? So let's say you could just get a warm washcloth and just set it on there.